do before you, we need to reform health care in areas of cost and things like pre-existing conditions covered when we change plans. Do the Republicans have a plan for sensible, affordable reform? If so, where can we get a copy? If not, why not?
Thank you for that question. Whoever put that down, we do have a plan. We have a set proposal. There are actually 3 bills that Republican members of the House have put forward. Unfortunately, not one of those was considered throughout the process of getting to where we are now, where HR 3200 is passed the committees and ready to go forward. Our challenge throughout this debate has been to be a part of the debate. We haven't been included. We were able to offer some amendments in committee. Very few, but I'm not sure if any of them passed. And I don't anticipate having any more favorable treatment like that on the floor. But again, very briefly, we are for affordable, quality, accessible health care for all Americans. And we think we can do it without raising our national debt, without increasing taxes, and without having a public sector option, having the government compete against the private sector. Again, pooling our resources, small businesses. Rand had some opinions on that. I think if we go across state lines, we drive those rules up dramatically. Right now in our country, as you all know, we basically got 51 different sets of insurance laws. The states regulate the insurance companies. I'm not advocating a federal takeover of that, but we need to find some medium where insurance companies can go across state lines and compete. Competition will drive those prices down. We need to treat corporations treat small businesses like we treat corporations. Like the slide I had, tort reform. Tort reform is a huge part of driving down the cost of health care in America. We need to again reward healthy living styles. Taking your cholesterol medicine, keeping your cholesterol low, not smoking. Maintain your blood sugar. And we can do these things. Again, my biggest concern is that we take our time. We've got a lot of options out there, a lot of good options, a lot of people working hard. We've got a tremendous amount of input from the doctors. One thing that's concerned me is talking to the doctors here in our district over the past couple of weeks is the future of general practitioners, the family doctors. I mean, because of the economics of our healthcare system right now, apparently you've got to just tug and pull somebody in medical school who want to be a family practitioner. Or they just have to see it as a calling. And that's a huge loss for our healthcare system. All of us want a doctor that we can trust. Someone you can go to, someone you joke with, someone you can have a burger with. And then who can refer you to a specialist if you need that. I mean, growing up over in Clear Lake, I remember I got in a little bicycle accident and got a concussion. And my mom called the doctor and he said, it'll be okay. I mean, from what you're telling me, he'll be fine. And he drove by the house there. I mean, Dr. Anderson, he was driving home, stopped in and checked up on him. That's the greatness of our healthcare system. It's one of the things that makes it so, so important. We can't lose it. We've got to give some incentives for medical students to pursue careers as general practitioners. But again, there's a lot of things out there. And my biggest concern is we're not going to get dog from on the floor of the house. We're going to have to see how this all works out. The bill is queued up, it's ready to go. It could happen as early as Tuesday that we're debating. And I welcome an open, honest debate on all the issues. And again, my wish right now is how this is going is we just slow this thing down. Sit down, take a deep breath, and look at it in a bipartisan manner and try to make some improvements that don't add to our debt, increase taxes, create a situation where the government is effectively making healthcare decisions for Americans.
I'd actually like to comment on some of the things that were said. I don't see how buying your insurance policy in Louisiana or Arkansas is going to make your health care any less expensive if you live in Texas. The reason that your health insurance is more expensive if you live in Texas is because we have more mandates than almost any other state, and we have a higher population of uninsured than almost any other state. And buying your policy in Louisiana, Arkansas, or New Mexico is not going to make your health care any less expensive.
concerns about competition risk pools. Competition drives the price down, larger risk pools drive the price down. It's something we have to look at. And again, the current system is not working. And I believe pretty strongly in competition again, and risk pools drive that cost down.
The reason that health insurance is expensive here is because health care is expensive. And the insurance companies are profiting just a couple % a year, just like the average small business. And just because you can buy that policy in another state is not going to make your claims be less in your state. It's not going to drive the cost of your health care down. I don't care how competitive that it is. If you remove the mandates that we have here in the state of Texas, the insurance companies will be able to charge you less, and you won't need to go to another state to buy your policy.
You can't stack 9 digits to get a giant. Let me start with that analogy for you. We have the largest pool in the state of Texas. It's the Texas Health Insurance Risk Pool. We have 20 or 30,000 people in that pool. They're charged double the rate of a healthy individual medical insurance buyer. Are you with me so far? They're charged double, and still, that pool of 30,000 cannot live under those premiums because there are a bunch of unhealthy risks. So, the issue of thinking that you can band together like a co-op, it would work only if everybody was just alike. Okay? But one individual steps into that co-op with a condition worse than anybody else, and it starts to shoot the rates up. Okay? So people start pulling out of the co-op when they find out they can get rates lower somewhere else. We've had co-ops in Texas for how many years? Many, many years. We can sell co-ops now. Okay? So we are in essence combining ourselves when we go with an insurance company like a Aetna or United Healthcare or Blue Cross, Humana, any of the big insurance companies. They are combining you, and they are pooling a lot of the risk. We need to tweak the system. There are many things we can do. Okay, one of those would be a guaranteed issue for everyone if we have a law that said everybody had to get into the system. Guaranteed 100% participation by everybody. And we can lower the rates dramatically. Another factor, I'm going on to another subject, but I know the question is going to come up about pre-existing conditions, because that's been brought up by several of you on the doctor's side of the panel. Do y'all know that pre-existing condition limitations, if you knew all about them, you would be voting for them? Because that encourages people to stay in the system and pay their premiums. And that's the only way it works. The best analogy there is you can't buy your car insurance after the wreck, can you? Okay? You don't buy your homeowner's insurance after it's on fire. You have to have everybody in the system. But the insurance companies have banded together and made in unison a promise. If we have a law that says individual health insurance is mandatory, then they will waive all pre-existing condition exclusions in that open enrollment period, and they'll take everybody. Are you with me on that? Okay. We can make reforms. Thank you, Dean.